let's discuss Pasteur Effect, Warburg Effect and Crabtree Effect and try to clarify the confusion. Pasteur Effect. Whenever glycolysis has already happened enough, now that glycolysis will push the molecules towards electron transport chain and oxidative phosphorylation. And when enough amount of oxidative phosphorylation has happened and when the oxygen levels are dipping, the oxidative phosphorylation will inhibit further glycolysis, because of which further glycolysis is inhibited and lactate formation is suppressed. Now, what about Crabtree effect? Whenever you increase the concentration of glucose in Crabtree sensitive cells, the glucose concentration in excess will inhibit oxidative phosphorylation, and that glucose will enter into fermentative form of anaerobic glycolysis, because of which lactate production increases. Now, what is Warburg effect? This is with respect to that of cancer cells. The cancer cells are rapidly proliferating cells which will take up the pathway of fermentation by blocking oxidative phosphorylation even in the presence of high concentrations of oxygen. Now, what is common between Warburg and Crabtree effect? In case of Warburg effect, the fermentation happens even in spite of high levels of oxygen. The Crabtree effect tells you the fermentation happens even in spite of high concentrations of glucose. In both the conditions, lactate will be elevated. Pasteur effect speaks about lesser amount of oxygen but lesser formation of lactate also.